Good evening and welcome to Doctors on Call. I'm Dr. Ruth Westra from the Department of Family Medicine and Community Health at the University of Minnesota's Medical School Duluth, and I'm your host for tonight's program on high blood pressure. We'd be glad to take your calls on diagnosis, problems, and treatment of hypertension. The success of this program is very dependent on you, the viewer, so please call in your questions and we'll do our best to address them. The telephone numbers for your questions can be found at the bottom of your screen. Our panelists this evening include Dr. Krissa Christian, an internal medicine specialist with St. Luke's Duluth Internal Medicine Associates, Dr. Ryan Harden, a family physician with the Gateway Family Clinic in Moose Lake, and Dr. Mike Swanowski, a PharmD with the College of Pharmacy, who also works at Essentia Health. Our volunteers answering the phones this evening are Barry Park of Ely, Minnesota, Linda Liskowitz from the medical school, and Joan Heimsness. And now on to tonight's program on high blood pressure. So we've had lots of conversations from our patients about blood pressure and hypertension, but Dr. Christensen, Christian, you could tell me, what is normal blood pressure?
An ideal blood pressure is 120/80 or less. There are 4 stages, and you're getting close to needing blood pressure medicine if you're about 140/90, and if you're above that, then you need blood pressure medicine. So ideally 140/90, but if you're between 120 to 140, I would recommend some lifestyle changes. And the top number is actually probably the more important number. We used to think it was the bottom number, but now for most folks that I treat that are over 50, you want to go with the top number being under 140.
And the top number, Dr. Harden, is like systolic. Explain the 2 numbers for us.
The top number when blood pressure is being measured is called the systolic blood pressure. That's the higher number, and that's when blood pressure is measured. When the cuff, when you put a blood pressure cuff on somebody's arm and occlude the blood pressure in that arm so they're not getting any blood flow to that arm, when the pressure in that cuff is released, it's the amount of blood pressure that's required to go through that cuff as the cuff is being deflated. That's the higher blood pressure that's a result of when the heart is contracting. So that's the systolic blood pressure.
And Dr. Swanowski, so how often should we check our blood pressure?
Well, it depends on how well the blood pressure is controlled. If blood pressure is really controlled well, it may be every time you go into the physician's office. That may be enough. If you're adjusting medication, starting something new, increasing a dose, well, then that blood pressure should be checked more often. And typically physicians will, if they're starting a new med or increasing a dose, will have the patient at least, if they're checking at home, check in a week, check in 2 weeks, see how the blood pressures are, or maybe have them back in the office.
So if we start a patient on a medication, how soon after that should we expect the medication to work?
It can take a while to really see the peak effect. Within a couple of weeks, you should see appropriate effect. By that time, you should have a good sense of where you're at.
Well, Dr. Harden, there also is conversation that we've had in the past about the size of the blood pressure cuff and the importance of not too large, not too small, just right.
Yeah, there are different size blood pressure cuffs. There's blood pressure cuffs for children, and sometimes those blood pressure cuffs should be used in adults that are smaller or more frail. The blood pressure cuff should wrap entirely around the arm if it's appropriate in size to measure. And if you do use a wrong blood pressure cuff, that can lead to inaccurate reading of blood pressure.
So back to you, Dr. Christian. When you are checking people's blood pressure and you have these early stages slightly elevated and more elevated where we're needing medications, what can someone do if their blood pressure is slightly elevated? Are there some lifestyle changes that they could do?
Yes, Dr. Westra. In fact, that would be recommended for somebody with high blood pressure and with just borderline blood pressure, or pre-hypertension is the doctor name for it. So the first thing is to eat right, and that would be as close to vegetarian, fresh fruits and vegetables, avoiding saturated fats and low-fat dairy. We call it the DASH diet, but I never remember what that exactly stands for. I don't think it matters. And then, of course, you want to avoid salt. You want to get regular exercise. 30 minutes at least 5 times a week is what I tell my patients. And then there's certain things like alcohol, especially if used to excess, that can increase your blood pressure. So you want to avoid too much alcohol.
What are the things that should we avoid, Dr. Swanowski? Anything else that would help us to keep normal blood pressure?
As Dr. Christian mentioned, alcohol for a man more than 2 drinks a day, for a woman more than 1 drink a day would be considered too much sodium, salt. She mentioned that there are over-the-counter medications that can possibly raise your blood pressure. Decongestant type medications can cause elevated blood pressure, so that's something to be aware of as well.
Well, we have a caller, Dr. Harden from Deer River, asking about white coat syndrome. And when people are at home, perhaps their blood pressure is normal. When they go to the doctor's office or have it checked, they feel that their blood pressure is elevated because they're at the doctor's office. What are your comments about that?
White coat syndrome or white coat hypertension is present when somebody comes in to see their physician and they get their blood pressure measured and it's elevated, but they consistently have normal readings of blood pressure at home. This is actually quite common. I think patients get a little bit nervous, a little bit anxious when they come in to see their physician. They may think they're going to hear something they don't want to, so their blood pressure goes up a little bit, which is a normal response. And up to 25% of people who have their blood pressure measured in the clinic, it's actually because they're in the clinic that their blood pressure is high and not because they actually have high blood pressure. I think the way to evaluate for that is to have patients check their blood pressure outside of the clinic. Mm-hmm. And oftentimes my patients will monitor their blood pressure outside of the clinics, and in order to make sure that the cuff they're using is accurate, I'll have them bring their blood pressure cuff into the clinic, check it against ours, and if it's accurate and they're getting normal blood pressure readings at home, then if their blood pressure is high in the clinic, then it's white coat hypertension.
Mm-hmm. Dr. Christian, a caller asking about if you had hypertension and you don't take medications, what are the risks of not being on blood pressure medications?
Wonderful question. So high blood pressure is often called the silent killer because it puts strain on the arteries that we don't feel, and it causes the arteries to harden and become plaqued. And that leads to things like stroke and kidney disease and heart attack, which are leading killers of the stroke and heart attack, are leading killers of Americans, and they're preventable causes. And so treating blood pressure, in addition to other risk factors that cause hardening of the arteries and plaques, is very important to preventing those diseases. Good question.
We're also worried, Dr. Harden, patients who have diabetes, we like to have their blood pressure under control. Can you talk a little bit about that?
Well, if a patient has diabetes and high blood pressure, that dramatically increases the risk of heart disease, increased risk for heart attack, cerebrovascular disease, as well as kidney failure or chronic kidney disease. So having chronically elevated blood sugars that people have when they're diabetic, in addition to elevated blood pressures, again, dramatically increases the risk of developing those conditions. So we typically recommend that patients who have diabetes we try to get their blood pressure actually lower than 140 over 80 and down to 130 over 80. Mm-hmm. So we tend to treat blood pressure in people who have diabetes more aggressively.
Mm-hmm. Well, Dr. Swanowski, a caller is asking about medications for blood pressure, for example, Norvasc, that might cause edema or swelling. Mm-hmm. Any comments about that?
It's a fairly common side effect, and so it's something that patients should be aware of and monitor. And if it's something that they just flat out can't tolerate, they're getting swelling of the ankles and it's uncomfortable for them, that may not be the medication for them. And it's dose related as well. A lower dose is less likely to cause that. Higher doses of that drug can cause that effect. An interesting note about that is if a patient is on a different medication to start with and you add Norvasc, say they're on an ACE inhibitor, they're actually less likely to get that edema. Or if they're on a diuretic already for whatever reason, something that pulls fluid off the body, then they may not have that edema either. But it's a fairly common adverse effect. Patients should know about it, so watch for it.
I think one thing I'd like to say about side effects is a lot of times when I'm prescribing medications to patients, they're really quite concerned about the side effects, which is appropriate, but oftentimes the side effects that are experienced when patients are prescribed medicines is about less than 5 to 10% of patients actually have that side effect. So in most cases, like the swelling you get associated with Norvasc, it's worth trying the medicine to see if they have the side effect. And if you, again, the vast majority of patients won't have that side effect.
Well, Dr. Christian, are there lab tests that we would do when we follow patients with hypertension and they're on medications?
Yes, there are. So I often annually will check kidney function tests and then blood salts, because some blood pressure medications will alter blood salts, driving down things like your sodium and potassium. You want to check, of course, for concordant diseases that happen because or with high blood pressure, like kidney disease, so you follow kidney function. And then lastly, one thing that I'd like to say is, so there are several risk factors that cause heart disease and stroke. Those are high blood pressure, which we're talking about tonight, high cholesterol, diabetes, smoking, and family history. Now that you can't change, but the rest we should always talk about and screen for. And so a patient with high blood pressure should be screened for other causes of cardiovascular disease. So I always check a glucose, I always check a cholesterol panel, and sometimes I check a special test called a cardiac CRP to put them in a risk category. Probably another show. But anyways, those are the lab tests that I routinely do. And if there's a problem with one of them, I might have them come back and have it checked more frequently. But usually, if they're very stable, their blood pressure is controlled, we check it annually.
Sometimes when patients have high blood pressure for a long period of time, I'll also check an EKG, even if they don't have any symptoms, to make sure that they haven't had any side effects or effects on their heart from their long-term high blood pressure. And also, it's reasonable at times to check urinalysis if patients have had high blood pressure for a long time to see if that's affected the kidneys.
Would there be any reason to do a chest x-ray, just to also talk about that?
Usually we don't do a chest x-ray for screening purposes. Chest x-rays are dictated by symptoms. So if they have shortness, if a patient were to have shortness of breath or cough, that wouldn't be explained, for example, by their ACE inhibitor, lisinopril. Anyways, you might do a chest x-ray.
Well, Dr. Swanaski, a caller asking about heavy smoking and the relationship of heavy smoking with blood pressure.
Well,
We talked a little bit about it, but
it's not good,
Right,
that's for sure.
right.
Another reason to quit smoking. It does elevate your blood pressure and obviously puts you at risk of many, many diseases in addition to heart disease, lung disease, cancer. And it is definitely one more reason to quit, because it will elevate your blood pressure.
I agree that smoking elevates blood pressure, but in addition to that, the reason that can cause problems with high blood pressure is it rapidly accelerates atherosclerosis, or hardening the arteries, when somebody has high blood pressure and is smoking at the same time.
Dr. Harden, let's talk a little bit also, a caller from Cloquet asking about when is blood pressure considered too low?
That's a good question. This actually comes up sometimes when patients come into the hospital on multiple blood pressure medicines, and we think about stopping some of the medicines because their blood pressure might be too low. I think most importantly, if a patient's symptomatic, sometimes patients will have a blood pressure that doesn't seem to be too low, but they have symptoms associated with that blood pressure, such as when they go from a lying position to a standing position, they can get dizzy or lightheaded or even faint in some cases. I think certainly if they're having symptoms, I think their blood pressure is too low. I think what we'd typically be shooting for in patients is when we're treating their blood pressure is a blood pressure less than 140/90, where they're not having any symptoms or side effects to the blood pressure medicines that they're on.
Dr. Christian, callers asking about how do you tell if you have high blood pressure? Can you feel anything?
Oh, usually a textbook would say no, but I do have some patients that know if their blood pressure is elevated, sometimes they'll tell me they hear something in their ear or they feel a headache. Or typically, blood pressure elevation is without symptoms. But sometimes you can have really high blood pressure and then you have some severe symptoms. You can have chest pain from really high blood pressure. That's different and separate from coronary disease. You can have headache. You can have bleeding in your urine from really excessive high blood pressure. But unfortunately, most of the time, for most people, they don't have any symptoms. So we need to just check it.
Well, Dr. Swinoski, a caller also is asking if you can have your blood pressure checked somewhere other than your arms. And would it be as valid?
Well, you can. I know there's wrist monitors that patients can get. Those typically aren't quite as accurate. There's a variety of ways that blood pressure can be checked, but the arm method is probably the most accurate, most consistent. Most people are familiar with that. The wrist monitors probably would not advocate for those. Do you folks have anything to add to that?
You can check a pressure on any limb, so sometimes if someone's in the hospital and we're using their arms for things, we'll stick a cuff on a leg, but I have never done it to anyone in my clinic.
And what about if there's a difference between one arm and another? Is it suggestive of something abnormal if one arm is much higher than the other arm?
Yeah.
There's an uncommon condition called coarctation of the aorta. And I think where there's an anatomical difference in somebody that causes the blood pressure in their right arm typically to be higher than the blood pressure in their left arm. And oftentimes that won't be noticed unless the blood pressure is checked in each arm. So I think it's reasonable when somebody's initially diagnosed with high blood pressure, especially if they're under the age of 30, that be checked in both arms to make sure that that condition isn't present.
Dr. Swinoski, is there a common medication that we try first for hypertension?
It's a great question because the thought process is changing a bit here on what is preferred to start first line, second line. I think typically at this point it is reasonable to start with a variety of blood pressure medications. ACE inhibitors like lisinopril, Dr. Christian mentioned that. That would be appropriate to start. Thiazide diuretics like hydrochlorothiazide, still probably one of the first line agents we look to. Could even start with something else. And sometimes it really, what it is, the consideration is there other disease that makes that choice more appropriate? If someone's diabetic, you want to start them on an ACE inhibitor because it's protective of the kidneys. So the thinking of what to start first, it really has changed, and it will continue to change. There's going to be a large guideline coming out called the JNC8, and they may shed a little bit more light on that. When is it coming?
JNC8? Right soon, probably.
Soon. Okay.
Well, Dr. Christian, too, we tend to kind of stack medications. I don't think that that's probably the correct medical term, but we start patients on one. If that's not lowering, we may add another. How do we decide to do that?
Oh, that's always so hard for a patient to accept. They might need 2 pills right off the bat for their blood pressure instead of 1. But a rule of thumb is that if a patient comes to you with high blood pressure and it's a new diagnosis, and let's pretend their blood pressure is 20 millimeters of mercury above where it should be. For example, somebody's blood pressure on the top number would be 160. Those folks typically will need more than one medication to lower it. And so there are nice medications that are made in combo form, so it's a combination tablet, thankfully, so you can give them one medicine or 1 pill and 2 medicines. But of course, if they have a side effect from it, you have to figure out which of the medicines cause the side effect. So many folks need more than 1 pill to treat high blood pressure. It's very common. It's very frustrating for the patient. So I would just encourage them to trust. You can find a doctor that they trust and can work with, and then try and find the right combination.
Well, Dr. Swinoski, how about time of day? Is there a time of day that patients should take their blood pressure medication?
That's a great question. Certain medications may work better at night, but the most important thing is it's whenever the patient can best remember it. I think at this time, that's probably the overriding best time to take it.
Right. Dr. Harden, a caller from Moose Lake, asking about blood pressure and pain. Is there a relationship? Would pain increase your blood pressure?
I think if somebody is in acute pain, the stress that's associated with that pain can cause their blood pressure to be elevated. So I hesitate when somebody's in because they have an ear infection or a sore throat or ankle pain or something like that to make a diagnosis of high blood pressure because, again, certainly their blood pressure can go up if they are in acute pain. But I think it's important that anybody who takes a blood pressure knows that if a patient has a blood pressure that's greater than 140/90, they should be told that they need to get in and see their physician and get that rechecked and make sure that that reading is either they don't have high blood pressure, or if they do, that they get in and get that rechecked to establish that diagnosis so we can treat it. But in order to answer the question, certainly if somebody's in acute pain, that can raise their blood pressure.
Dr. Swinoski, a question from Duluth about beta blockers and what they do.
Okay. Beta blockers work mostly by slowing the heart rate down a bit. That does allow for the blood pressure to be lowered. They also do have some relaxant effect on the blood vessels, but primarily lowering the heart rate is how they accomplish what they need to do.
Caller from Floodwick, Dr. Christian, asking about if it's okay to take your blood pressure over your clothes, which is probably a good question to ask.
Oh, yeah. If the material is thin enough and you can still hear the pulse when you deflate, I suppose it is. I prefer to make sure that I'm hearing the blood pressure very good, because your own hearing is dependent on your read, or the read is dependent on your hearing, and so I guess ideally you would have your stethoscope against your flesh, so that would be best. It's not always possible.
Sometimes people will push their sleeves up, and sometimes I'm feeling like perhaps that's not good either, because then that sort of acts tight around the skin. Dr. Harden, a caller is asking about fluctuations of blood pressure with position, like if you're sitting or laying down. Is there a difference?
Yeah, that's a good question. When somebody's laying down, their heart does not need to pump against gravity. So their heart's pumping in a horizontal fashion. So typically when somebody's laying down, their blood pressure's lower. When somebody stands up, their blood pressure is typically higher because their heart has to pump more against gravity. So I think it's important then when people have their blood pressure measured to see if they have good control of their blood pressure, that it's, again, in the traditional seated position with their arms relaxed and on a, either the right or left arm. But again, blood pressure does change with position. And a common side effect of some blood pressure medicines is that blood pressure is normal when they're sitting, but when they stand up, it either doesn't go up quickly enough, or it doesn't go up enough and they get dizzy, lightheaded, or they can even faint from that. So a lot of times if patients complain that when they stand up they get dizzy if they're on blood pressure medicines, it's important that we check their blood pressure when they're lying down, sitting and standing, to see if they're having normal blood pressure fluctuations with the changes in body position, because again, that's a common side effect of some of those medicines.
Orthostatic hypotension.
Orthostatic hypotension,
Particularly with older patients, they lose the ability to respond to that when they stand up if they're on multiple medications especially.
If that happens, we would usually probably adjust their medicines.
Yeah. I do think it's important too that if when you see a patient, they come in for a blood pressure check or something like that, if their blood pressure's at goal or lower than goal and they've been on that medicine for a long time, it's worth either decreasing the dose to see if they can tolerate a lower dose, or stopping or adjusting their medicine. So once somebody comes in and gets their blood pressure under control on one or two medicines, I think that's important that's why it's important for them to be seen on an annual basis, because their needs for those medicines might change based on new diagnoses, based on changes in activity level, based on changes in diet, or based on changes in their weight, which will affect their blood pressure independently.
The weight would probably be the big one. Just a quick question at the end here. This is our last question about blood pressure cuffs at Walgreens, et cetera, when you're shopping. Is that accurate?
Well, I think, like Dr. Harden mentioned, bring the cuff in when you have your physician visit. Test it with the cuff at the office. See if it's accurate. If it is, if it matches what you're getting in the office, it's a good cuff. Talk to the pharmacist, see if they have a recommendation for the cuff. See if the physician has a recommendation. Oftentimes they'll recommend certain brands that they know are accurate. And so yes, you can find an accurate cuff at Walgreens or other outlets as well.
Yeah, absolutely. Well, thank you. So I want to thank our panelists, Dr. Krista Christian, Dr. Ryan Harden, and Dr. Mike Swanowski, and our phone volunteers, Barry Park, Joan Heimsness, and Linda Liskowitz from the medical school. Please join Dr. Ray Christensen for a program next week on healthy living and prevention, when his panelists will be Dr. Gail Baldwin, Dr. Jake Pronowski, and Dr. David Sproat. Thank you for watching. Happy holidays and good night.